everyone. Welcome to this week's Tuesday Tips. And we are live on our Facebook page. And I just want to thank you those for stopping by. And if you're catching this video on our Tuesday Tips replay, we are very glad to have you that as well. And we also will have this here on our Facebook page. And also when it's finished, we will add that to our YouTube channel. So we are looking forward to a fantastic topic that's really shaped the way seniors receive care today. We're going to go ahead and explore how healthcare for older adults has evolved over the decades, from house calls long ago to the modern convenience of telemedicine, and how that's impacted our seniors. And one of the reasons why I wanted to do this topic is to try and show why we need to try and embrace some of these new technologies, because I'm going to demonstrate with some statistics that we've collected on how it really is making a difference on the care of our aging adults. So if you're passionate about, senior care, you're in the right spot. So don't forget to use the comments to share your own experiences or questions while we're live. And we welcome your comments on our YouTube channel when we share the replay video as well. So to kick things off, here's a question for those that are watching. What's one change in healthcare that has had the biggest impact, do you think, on an aging loved one? Drop your answers below. We'd love to hear from you. And if we've got any of them live, I will share them and see if we can have a little bit of a discussion on that. So go ahead and drop those into the comments if you'd like. So house calls long ago. And when we moved from Kenosha County, Wisconsin to kind of the mid or southwestern Wisconsin, we moved to a very rural community called Cashton. And it is a very, when I say rural, it's very rural. We're about almost 25 minutes to the closest Walmart, and we are smack dab in the middle of an Amish community. And all three of our four neighbors surrounding us are Amish. And why I'm talking about that is when we moved up here, my dad made a comment. He said, Pam, he said, you haven't moved 200 miles away. You've moved 200 years away. And so when he says that, it really put things into perspective, because if you look at the Amish still today, they don't like to go to hospitals. They do. They prefer physicians or nurses, nurse midwives, or midwives in their community to come and into their homes. They care for their own. They're a pretty closed community. You won't see any Amish in assisted livings or senior independent apartments or nursing homes or that. I mean, even those that are no longer able to care for themselves, they have assigned their community assigns people to care for these individuals in their homes. And so when you think that that's how it was many years ago, not just the Amish, that's how it was for all of us. And so there was no rush into the doctor's office or the hospital. House calls were the norm. Oh, we need to get the doctor here. Doctors brought care straight to the patient, often with a black bag in their hand. And while personal care was limited by resources and technology. So fast forward to the mid 20th century, hospitals began to take center stage, offering specialized care that wasn't really possible at home once technology, took over. So did you know by 1950, about 60% of hospital beds were filled by patients over 65? It was around this time that senior health care became a clear priority. So think about that. Back already in 1950, more than half of our population was aging adults. That's quite a large chunk. So then during the 1980s and 1990s, we saw the rise of preventative care programs. So Medicare started covering screenings for things like cancer, diabetes, and other chronic illnesses. This was really a major turning point, and it really helped detect issues before they became serious health problems. And one study found that between 1991 and 2018, mortality rates for seniors with chronic illnesses like heart disease dropped by more than 20%. So that's it. That is a huge statistic as well. So today, telemedicine is really revolutionizing accessibility for seniors. So with just a smartphone or a computer, older adults can connect with their healthcare provider, refill prescriptions, or even receive therapy without leaving home. Convenient, right? I agree. During the pandemic, the use of telehealth by seniors jumped to 43%. I have one of our clients, we have a behavioral health telehealth visit, every couple of months. And is we do that over Zoom. And it's really nice because I can participate. I'm not in the same location as that client. And so I can participate, via Zoom. And we're all, it's really makes it really, really nice for us to be able as advocates, also to be able to serve clients, not, outside of our small geographic location. And this also ties directly to the age-friendly health systems initiative. And this was started a couple of years ago on just trying to strive to make healthcare more accessible, respectful, and align with what matters most to our older adults. And thanks to these efforts, hospitals and clinics across the country are now creating systems that support dignity and independence for our seniors. And there's actually even a certification that clinics and hospitals can get, that they can become certified, so to speak, in age-friendly systems. And that's really important because, ageism we went through and we still do. Ageism is a real thing. And what ageism is it's a discriminatory thing, just like we would discriminate against many other things that we're all familiar with. Ageism is a discrimination of aging adults, dismissing them, not taking them seriously, throwing them out, that they're, no longer good to society. They're a burden. We have to take care of them. And that's all part of ageism. So age-friendly healthcare initiative strives to diminish those feelings of ageism and make healthcare really designed to meet the needs of our seniors. By the year 2030, every single baby boomer in the United States is going to be 65 years of age or older. So what is that going to do to our healthcare system, senior living, all aspects of the care that we provide our seniors? So I just want to share some kind of neat statistics. So this is what, some of the highlights that shows us just how far we've come. So healthier seniors are living longer. The average life expectancy in 1950 was 68, but today it's nearly 77. And some would argue that it might be a little bit more. And telemedicine, this is fascinating. I was even a little surprised when I read this, but telemedicine reduced unnecessary ER visits by 45% for seniors in rural areas, according to a study done in 2022. So some provider groups are all telehealth, and rural health has been one of the issues where seniors getting access. And so oftentimes, like where we live, we're 35 minutes to the closest to 3 hospitals, all 3 in different directions, but all 3 are 35 minutes away from where we live. And so that's over a half an hour, to get to a hospital. So when you can think of telemedicine, I can easily now, when I think that through, how, telemedicine has reduced ER visits for our seniors by 45% in rural areas. So we can access a provider much quicker, than 35 minutes. So by the year 2030, 70% of U.S. hospitals aim to implement full age-friendly programs thanks to this initiative. And we implement that. So if you become a client of ours, we implement in our assessment process and our process to look at your particular situation and needs. We use the 4 M's, which is part of this age-friendly program. And what does that mean? So that's 4 M's. The first M is what matters most. What matters most to the aging adult? Not what matters to us, not what matters most to the doctor, what matters most to that aging adult. The second M is medications. The third M is mobility. And the fourth M is mental health. How are our aging adults doing? Because there's a lot of special risks for our aging adults. Depression and isolation are really impact our mental health of our aging adults. And there's home substance abuse treatment programs now that are proving up to, in some cases, 95% effective. There are many programs out there that people are able to participate in home, because and that's kind of neat, because you look at I attended a program actually today where they talked about that a lot of times the issues with substance abuse and their triggers are in the home. So if you remove them from the home and put them in a facility or put them somewhere else, once they get back home, they start falling into those old habits. So if you're helping them in the home where those triggers are, that's where they need the support. So really things are coming full circle in many ways. And there are provider groups also that do provide just services to senior living communities. I have a client that lives in Kansas. She's in an independent apartment, and they have a provider group called Curana. It's nationwide. And these providers, all they do is go into senior communities such as independent apartments and assisted livings, and they become their primary care providers. But the difference is they come to them. And, I just think, how cool is that? I think that really is helping our seniors, because some are mobile, have mobility challenges, and it's very difficult for them to get out to the doctor. But by having the doctor come to them, what a convenience that would be. So, this kind of wraps up, how we're looking at senior healthcare and how it's transformed over the years. I'd love to hear from some of you, and to see how maybe technology has helped your aging loved one, or can you maybe share an example where maybe you were hesitant with telemedicine or telehealth, and it really worked out to your advantage? We'd love to hear that, because we're it's new, and the older we get, the less flexible we are to change. So we really love to hear some success stories on how your aging loved ones have been able to embrace, technology, and how that's made a difference in their healthcare. And just wanted to say some of the resources we've used: National Institute on Aging, that is one of my favorite resources. AARP also, they have an article, Trends in Senior Healthcare. The Journal of Telemedicine study we used for some statistics, and just age-friendly health systems. So those were some of the resources that we used to bring you the information today. So we are very, very happy that you joined us. We look forward to seeing you at another Tuesday Tips next week. And in the meantime, take care. Reach out if you have any questions, and we'll see you at another Tuesday Tips real soon. Take care now.